Flu season is in full swing here in North Carolina, and states have seen a major spike in cases just since December. Dr. Scott Spees from Novant Health is here with me this morning with a few remedies that really do work and even some that you may think work but aren't. First, let's kind of break down what the flu is, because sometimes, and I was just telling you that my family had a stomach bug and we thought it was the flu, but it probably wasn't. What exactly is the flu? What are the symptoms?
Right, yeah, the true influenza is generally going to be high fevers, 102 to 104 degrees, for at least 3, 4, sometimes 5 days. Significant sore throat, cough, runny nose, red eyes, and you look basically like you've been hit by a truck. It's really miserable.
To a lot of parents, hearing fever is a major concern. 103 and above, and we've always been told 103, call a doctor. You say it's not necessarily as dangerous or serious as it might appear to most.
Well, the first thing I tell parents is that there is no fever that's going to hurt a child. So there's a lot of fever phobia out there that's really unnecessary. The fever is the body's immune system's way of fighting an illness. So if your child has a low-grade fever in the 100, 101, and they're happy, you don't have to do anything about that. Most kids, when they're over 102, they're pretty miserable, so I think it's reasonable to try and bring that down with some ibuprofen or acetaminophen, depending on their age, and making sure the doses are correct. But again, that's really for comfort. That's not to treat the underlying problem. Again, the fever is the body's way of fighting the illness, so it's not a bad thing, and it's not harmful.
Okay, well, that hopefully eases some fears, because I think anytime a child's body temperature goes up, most of us just kind of go into shock ourselves and become frantic. So what are some things that parents can do to make sure they ward off the flu, not just in themselves, but in their children?
Well, the biggest thing is trying to avoid illness. So if you know somebody that's sick, try not to hang out with them. If your child is sick, try and keep them home. And then the basic things like hand washing and use of hand sanitizers, those sorts of things, coughing into your elbow, just basic hand hygiene and illness types of things. Trying to stay home until you're at least 24 hours fever-free from the flu before you go back.
How important is hydration?
Well, there's a lot of things that are important when you're sick, and hydration is one of the keys. So the biggest factor is making sure you're drinking a lot of fluids. Keep that water going. Chicken soup has been shown to be helpful with fighting the flu. There's actually been a
So it's
valid
not just
study.
an old wives' tale.
It's not just a wives' tale. There's actually a valid U.S. study that shows that chicken soup has been helpful. Things like cough and cold medicines, vitamin C, ginseng, zinc, things like that are minimally beneficial, but basically your body has to fight it. But if you're having more than 3 or 4 days of fevers, you probably do need to get checked out by the doctor to make sure that the flu hasn't turned into pneumonia or something more serious.
Okay, before I let you go, Doc, at your house, you've got a bout of the flu, one of the kids has a bout of the flu, how do you treat it?
We stay home, we drink water, eat chicken soup, and ride it out.
Okay, all right. Wife, if you've heard that, that's how the doctor handles it, so we don't have to stress about it. Always good to see you, Doc. Appreciate having you.